From the 22 News Plus studio, this is 22 News in Focus with Patrick Berry.
Hello, everyone, and welcome to this edition of InFocus. I'm your host, Patrick Berry. We have a fascinating conversation today. I'm here with Dr. Katrina Banks. She is a neurologic specialist specializing in brain wellness. So, Dr. Banks, I want to thank you so very much for joining me here today, because our brain is probably outside of your heart. I guess you could label every organ the most important organ.
Absolutely.
But your brain is crucial to everything that you do, things that happen within your body that you don't control, that your brain triggers breathing and all that other stuff.
Absolutely.
But there are certain things that you can help your brain control. And that's what I want to learn more about from you today. But I want to start with you. I want to learn a little bit more about how you got interested in brain wellness and a little bit about your practice.
Okay. Thank you, Patrick. I really appreciate you invited me to your show. And, the brain is a very, very cool thing to really study. So I got intrigued with brain health. Actually, my aunt had a stroke when I was in high school.
Oh, wow.
So I was puzzled by why she had right-sided weakness, and her speech was off. And I was like, what's going on?
And as a teenager, yeah, that's really,
it was perplexed.
Well, it's got to be hurtful. I was fortunate my father didn't have a stroke until I was in my 50s, and he was near 90. But as a teenager,
yeah, so
it's got to catch you off a little bit.
Oh yeah, so it was intriguing to be like, oh, what's going on? Like, what's happening? And then learning more when she went to physical therapy, and learning that it was a brain issue. I was like, oh, this is what happens when your brain isn't functioning so well. So that inspired me at first, and then as a physical therapist, I worked in many different settings and just was intrigued with people with neurological impairments, disorders, Parkinson's, MS, stroke, and how they presented. And I just knew that they needed specialty care.
So as a therapist, you're working with those patients who had a brain injury previously, whether it's a stroke or an accident or whatnot.
Yes.
So that moved you along your career path.
Absolutely. And it was just intriguing to figure out how they presented, how everybody was different with their brain health.
So not every stroke is the same.
No, nothing is textbook, which is amazing. Because,
which is good and bad.
Yes, because it keeps me on my toes and it allows me to think more outside of the box and how I can help my clients.
Interesting.
But just a common denominator that I found with everybody that I've worked with is that they had other stressors. They weren't sleeping well. And it was like, okay, what is happening here? And just noticing that when in traditional healthcare, they're just treating symptoms.
Right.
You're not sleeping well. Okay, take this pill. And just that cycle, of that happening, it was like, okay, what is the real cause of this? I'm like, it's the brain.
So throughout your years in practice, in talking with patients, you're learning other things aside from maybe what caused the injury or caused the brain problem to really dig into what the root cause may have been?
Yes. So I adore the holistic approach. So when I
look
get
at
to
the whole body,
head to toe, and just getting to know my clients. So we're just talking, I'm talking to them at their initial evaluation and asking them, how's everything at home? Are you stressed? Are you sleeping? How's your nutrition? Things that people, in traditional healthcare, they go in because their foot's hurting or they had a stroke. They're just focusing on those things.
Right.
But you need to focus on the whole body, the whole person.
Right.
So people start sharing their life story, and these things are happening at home. I'm not sleeping well. And I'm like, this was just a repetitive cycle. So I'm like, you know what? This is a brain issue. The brain is the control center.
Exactly. It controls virtually everything in your body.
Absolutely.
So how did you turn your fascination into a practice of helping people?
So I kept seeing in my career that there were a lot more neurological impairments with people and that there wasn't a lot of specialty care once they left the hospital.
Okay.
So I was like, you know what? And I worked across the country. I did traveling therapy. I worked in
Wow.
Texas and Arizona. And I just kept seeing those individuals and they would work with me and then they would be discharged. But it was nowhere to be found, like to have them continue their care. So I kept seeing that. And then I said, you know what? I really have to open a specialty clinic to help this population because they need help just like everybody else.
And is it a growing population?
It is. I mean, Parkinson's is growing exponentially. There was a recent research article that talked about it being mainly from environmental toxins.
Really?
Which I believe that because a lot of the patients that I work with, they're like, no, there's no family history of it. They just automatically end up with it.
Something in their environment
absolutely
could be triggering it.
Plus stress and not nutrition, like all those things, not sleeping well, that causes your nervous system to be really out of whack.
Okay.
So there was a need for this clinic to happen.
Now, so you're based here in Western Massachusetts.
I am.
And how long have you had the practice?
I've been in practice 5 years, almost 6 years.
And has the number of patients grown in those 5 years?
It has. It has. But I've shifted a little bit. So I still see my neurologic population, but I'm starting to see younger people, like entrepreneurs, CEOs, that are stressed out. They're having strokes at 30 in their 30s, their 40s, and their 50s, and they're having brain fog. I'm like, this is another brain issue that we need to really focus on. So right now, I'm seeing kind of two populations. I'm working still with my neuro population, but I'm also working with professionals, CEOs, entrepreneurs that really need help with sleep. None of us are sleeping well.
No, we're not. And I'm in that group. We're up on our first commercial break. So I want to talk neuro wellness when we come back and learn a little bit more about that. We'll be right back after this.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back, everyone, to this edition of In Focus. If you're watching us and you're paying attention, you know what I'm telling you. You can thank your brain for that. Dr. Katrina Banks is across the desk from me today. We're talking about brain health and the importance of making sure your brain is healthy because it operates everything in your body. I teased just before the break that I wanted to talk about neuro wellness.
Mm-hmm.
It sounds like a fancy term because I don't know what that is. So explain what neuro wellness is.
Just taking care of your body, basically. Okay. So what I basically do is I help people connect their brain and their body awareness.
Okay.
It's something that, we don't think about. We just go. Our brain just says, okay, we know our routine. It's very routine. We're going to do what we need to do. But sometimes we need to pause and feel. So I teach people just how to connect their brain to their body, how to be more intentional.
Are you teaching people to meditate?
I am.
Or is that just one aspect of
one aspect of it, but the awareness is the biggest component. Being aware that, okay, I'm not sleeping well. What am I going to do about it?
Okay, so I'll tell you, I don't sleep well. Mm-hmm. I just chalk it up to I'm a 58-year-old man. I'm getting older in life. Mm-hmm. People just don't sleep well as they age.
Yeah, but go ahead.
No. Is that true?
So yes and no.
Okay.
Yes, age, does have an effect, but we can also rewire our brains. It's called neuroplasticity.
Okay.
So think of it as a kid that is learning how to ride a bike. They're creating a pathway to ride this new bike, but they fall several times. But once they continue to practice over and over, they're building a new route in their brain so that they can ride that bike and they master it. Same thing with us adults. When we train our brain and be intentional about it, you can do new things.
So it's again, like your bike idea, it's like learning an instrument, learning a foreign language.
Yes.
You have to train your brain to do whatever it is.
And be intentional about it.
Okay. So how do you be intentional about learning to sleep better?
So I have introduced this neurotechnology by the name of Brain Tap in my clinic. And it's a piece of neurotechnology that basically retrains your brain. And it combines these tones, neural tones, that that happen within both ears that help calm the nervous system. It has meditation component of it, and it has scripting. So combination of those things, it has these lights inside the headset.
So it's a non-invasive.
Non-invasive.
Okay.
And it takes only 20 minutes to rewire your brain. So think about that bike example and doing this brain technology, brain tap consistently, you start to see results really quickly. So the beauty of it is in my clinic, I can do a neural check or a brain health assessment, and that will tell me how you're sleeping, what your stress levels look like, how your heart is talking to your brain, what's your inflammation, how your hormones reacting, how you're thinking cognitively. It gives you so much concrete information that you would not get from your primary care doctor.
Interesting. So then you take all that data, because it sounds like it's just data-driven science.
It is. I take that data, and the BrainTap has an app with all these different programs. Some of those programs, some are for sleep, for stress, anxiety, chronic pain, hormones, for kids with ADHD. There's so much on this app. But what I do is based on that neural check or brain health assessment, I look at your results and say, okay, I need to create you a plan for sleep. Depending on what I see. If it's for sleep, I'm going to create you a plan on that app and have you do it. And that's why I created the 90 days program, and it's called the Elite Sleep Reset Program. And
so within 90 days, you work with your patients to, and we'll use sleep as the example. That's one brain function that somebody's concerned about. So within 90 days, you're able to help them retrain their brain to become a better sleeper.
Yes, and sleep through the night. And people get results. My clients get results within sometimes one session.
Really?
Yes.
So what are some of the training? Is it, I don't, explain to me what the trainings are, because I'm fascinated by this. I'm looking for a good night's sleep.
So it's the headset.
Okay.
It's called BrainTap.
So you sit there with this headset on.
Yep. It has lights in the ears that help calm the nervous system. It has lights in the visor that help calm the nervous system. And basically those lights retrain the different brain waves. So you have your delta wave, your theta wave, your gamma, your beta. Those waves are retrained, but I get to help you choose which one you need to work on. So if like sleep is delta. Most people that I see, their delta wave's way too high. It's like 80, 90%, when it should be like 15% for you to sleep through the night.
Holy smokes, that's a big difference.
So the beauty of it is, once I see that on your brain health assessment, I can say in the app, I want you to do these sessions.
Okay.
And you play the sessions through the app, but it plays through the headset. And those lights just rewire the brain waves.
Interesting.
It's really cool.
It's amazing that, I guess it shouldn't be amazing to me that you can do that, because we mentioned earlier, learning a new language, learning an instrument. Okay, so let me ask you, if somebody has a difficult time, say, learning an instrument or learning a new language, will it take longer to retrain their brains to help them sleep better? Or is that totally unrelated items?
I mean, it depends. So if they wanted to learn a new language, then we would focus on maybe more focus or more concentration.
I should have come to you before my Italy trip. It would have been a much more successful vacation.
So that's the beauty of it. So when I look at your assessment, I'm like, oh, you're not sleeping well. And then that...
You're not sleeping well, and you don't know Italian.
Right.
I could have killed two birds with one stone.
Usually they interact with each other.
Okay.
So when you're not sleeping well, then you're not thinking, you're not processing, you're not concentrating well. So I can go in the app and say, okay, I want you to work on your theta waves. To get you to focus more, your alpha waves, so that you can relax more and be more creative. So it's really awesome.
So let's fast forward a little bit. After people go through this process, what do they come out on the other side feeling like?
So they're sleeping better, they're thinking better, they're more productive. I mean, and that's the beauty of it. You're able to live your life a lot better. Like, you're able to problem solve things that you didn't think you could.
Right.
And they get that guidance too. So I do a lot of group coaching. So if people have questions, they can ask questions. If they're done well with sleep and they want to move on to a whole different category, or they want to focus on their attention, we can focus on that.
It's interesting. There have been so many studies about the importance of sleep.
Yes.
That I have to imagine, just based on this conversation we're having now, just in the brief time we've had, sleep has to probably be the most common affliction, for lack of a better description, that people come to you for, because sleep. If you're not sleeping properly, you're miserable during the day. Your stress level increases. Your diet changes.
Correct.
Sleep has to be the trigger for a lot of things.
It is, and that's why I created that Elite Sleep Reset program. Because again, people complain, "Oh, I'm not sleeping well. I'm brain foggy." And with sleep, if you're not getting deep REM sleep, that means your brain is not getting rid of those neurotoxins that allow you to function for the day. So I tell people all the time, you think you're getting 8 hours of sleep, which you probably are, but is it recovery sleep?
Right. All right, we are up on our next commercial break. We're here with Dr. Katrina Banks. We'll be right back after this.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back, everyone, to this edition of In Focus. I am your host, Patrick Berry. Today, we are talking to Dr. Katrina Banks. She is a board-certified neurological clinical specialist. It's a lot of words there, but basically what she does is she makes your brain healthy so the rest of your body and the rest of your life is healthy. There have been so many studies, we talked about this earlier, about the importance of sleep. But again, no matter what your lifespan is, say you live to be 100. Just, I'm making the math easy. If you sleep 8 hours a day, a third of your life is unconscious. So you're really only living to 66. Okay. That was my mentality as a young man, like in my 20s. That dawned on me. I said, I don't want to be that guy. So I would get up early. I would stay up late. And I jeopardized my sleep. But that's everybody. Everybody, I think, is doing that. Whether it's consciously saying, I don't want to be unconscious for a third of my life, to I need to work hard. I need to succeed at my job. I need whatever it might be. But that's, to be very blunt, that's killing us.
It is.
It's making it worse.
Yes. And society tells us that we need to work harder and we need to push through. And like you said, when we push through, our bodies has had enough, then we end up with autoimmune disorders or issues. We end up with having a stroke, obesity.
Right.
Yes. So getting that 8 hours, yes, it takes a third of our life. But when you get a good 8 hours of REM sleep, you are getting rid of those neurotoxins that require you to function during the day.
Okay.
You have less brain fog. You're more productive. You're able to get through the day and make better decisions, especially if you're a business owner. So it's super important.
So staying up late or getting up early and losing sleep is actually hurting you during the day from making important decisions.
That is correct. And you don't make it up. It takes like 9 days for you to, if you were to get back on track, it takes about 9 days for you to regain that sleep pattern again. So like most of us say, oh, we'll catch up on the weekend.
I do that every week.
Oh yeah, we all do.
And I never do.
We
I'm up
all
early.
do. But no, your body's like, nope, sleep that minus 6 hours if you didn't sleep through the week.
So that brings up an interesting question. If it takes 7, 9, 10 days to sort of get your body back in, are those like shutdown vacations beneficial? So if you, hey, you know what? I'm going to go to the beach for a week. I'm going to do nothing. I'm not going to bring my laptop, my cell phone. Those are helpful.
That's one of my neural frameworks, and it's in the research as well. You just do a zero output day where you like no phone, no TV, not even talking. You're just relaxing.
sit, read a book.
That's it.
Veg on the beach, in the forest, wherever it might be.
And I encourage my clients, plan it out every 6 weeks. One day where you do nothing, no phone calls, nothing. If you want to do it on a Sunday, do a half a day.
It's interesting because as I've gotten older, the cell phone is it's attached to us all the time. And sometimes my wife or my kids would be like, Dad, where have you been all day? I make it a point not to, I just want to disconnect.
Yeah.
For no other reason than, hey, you know what? Well, this weekend I'm going to rake leaves, but that's it. I'm just going to go rake leaves, cut the grass, do whatever I want, but I'm disconnecting for, several hours at a time.
Absolutely. That's very healthy because
It is.
that blue light causes your brain to stay on. So I tell a lot of my clients, before you go to bed, we got to create this new sleep routine where like an hour or two before we're starting to wind down and you're not doing any blue light. You're not looking at the television. You're not looking at your phone. You're creating this atmosphere of, a calm room or some good aromatherapy that smells good, and you're doing your brain tap and you go to sleep.
So is part of the ongoing maintenance creating a routine at home or during your day?
Yes.
And I know some professionals who it's lunchtime, noon to 1, 12:30, 1:30, whatever their hour might be.
Yep.
They disconnect. They go for a walk.
That's perfect.
It's an ongoing maintenance.
It's an ongoing maintenance. And with my sleep program, I actually have my clients purchase a wearable. So it could be an Oura ring or an Ultra Human ring where we can measure your REM sleep or measure your sleep every day. You get a sleep score every day. And I can monitor it from my computer as well to say, oh, you got an 80 this last night. So that means you slept pretty well. But it will give you that detailed information about your REM, your sleep cycles. Did you have good brain neurotoxin clearance? It'll tell you all of that. And that's what people need, awareness.
So if people have a smartwatch or a smart ring, use it for good, not evil.
Absolutely.
Really?
Absolutely.
Because I always take my watch off at night.
I do too, because it doesn't last, the battery, for one.
True. Right.
So, but if your wearable allows you to track sleep, you want to know what your numbers look like so that you can say, oh, I didn't sleep well last night. Okay, now what do I do?
Then that increases my stress.
It does, but then we figure out, okay, what do we need to do to fix this?
Okay.
And creating that awareness is huge.
I guess you're right. Once it's like anything. Once you know the cause of it, then you can treat the symptom.
Absolutely.
Treat the root cause. I guess is what I'm trying to say.
Because even on the wearable, I'm doing a program myself.
Okay.
On the wearable,
so you're not immune to it.
I'm not immune to this at all. It'll say your heart rate dropped too late. So that usually means you ate late. Or you exercise or some type of stimulant caused you to go to sleep a little bit later.
Okay.
So being able to know that, you're like, okay, maybe I need to eat dinner an hour or two before or not exercise, 2 hours before I go to bed. So just being able to know that information and then figure out, okay, what do I need to do to curb this?
We've only got about a minute left, but I want to quickly ask the question, using a wearable to determine, or does using a wearable device help determine whether you've got sleep apnea, because you may not know you have it.
It could potentially.
And then that causes the sleep problem and then it snowballs.
Absolutely.
Interesting.
And that's why combined with the brain health assessment and looking at your waves and looking at and the wearable, you can see that something's off. And you get the concrete information in front of you. Most people are like, wow. They're like, oh my goodness. Nobody's ever said anything to me like this.
Sometimes technology is helpful, right?
It's very helpful.
Dr. Katrina Banks, I cannot thank you enough for this conversation.
Thank you so much.
In a good way, it's eye-opening. Hopefully not at 2 a.m. Wonderful having you. Good
Thank you so much for the opportunity.
This is 22 News in Focus with Patrick Berry.